Hello, dear everybody. I am wearing my millions missing ME t-shirt because there's millions of people with ME missing from their life. And this is going to be a chat with a couple emotional and practical tips for people with ME when they get COVID. But we'll talk about it in a way that is accessible to you, yes, you, if you have also never heard of ME. So let's get into it. I have had ME for over 20 years and I used to be severe, but never very severe. Severe meant for me that I couldn't talk, couldn't walk, couldn't read. So ME is lots of really bad physical symptoms and really weird symptoms as well. And lots of really bad and weird cognitive symptoms. Here are some of them. Studies like this one show that patients with ME are super disabled and super suffery compared to very common illnesses that freak us out and that we take very seriously, like cancer and heart disease. Part of the reason this group of patients is so badly off on paper compared with other illnesses is that the very severe ME patients are just as sick as you can imagine a human being really being, short of not being alive. I mean, we're talking about people who can't tolerate light, can't tolerate touch, who need to be tube fed and so on. So we're looking at, again, 1 in 250 or more people with this condition we estimate globally, the majority of which are women. And that's also true of some autoimmune diseases. They are also mostly female diseases. And ME breaks down into a quarter men and 3/4 women. Before we say anything more, we've got to position ourselves in a place where we get an important three-way distinction, so I need you to indulge me, please. Three-way. Number one, there is a distinction between disability and suffering. You can be more disabled but not suffer as much, or you can suffer more and be less disabled. So disability is to do with capacity, how much functioning you're up to. Suffering is to do with right? Stuff happening in your body that is really bad, makes you want to press a button to stop it if you can. So don't assume that the stuff always goes together, right? Somebody can be 95% bedbound and suffer less than somebody who is 60% bedbound. So get that. Second bit of the three-way distinction is between stability and volatility, right? Disability and suffering can be stable or volatile. You can feel the same on a Wednesday as you feel on a Tuesday and feel that all day long, and that's stable. Or it can be volatile. Each 3-4 hours is very different, or each week is very, very different. So stability and volatility. Don't assume that what somebody is feeling between 5 and 8 p.m. on a Tuesday is what they're going to feel, all the way through the week. It could be a lot better. Then the rest of the week could be a lot worse than the rest of the week. The last bit of distinction is safety versus unsafety. So symptoms that are to do with making you suffer a lot, not just disabling you a lot, can make you suffer in a way that is safe or unsafe. What does that mean? Well, imagine you are in kind of 6 out of 7 level muscle pain, which is terrible muscle pain, right? 6 is terrible because humans can feel a lot of pain and it gets really extreme. If somebody told you, look, it's moving from 6 to 6.5 for the next few days, you'll feel, okay, this is really bad, but I know what that extra half is. It's like 6 plus a bit more. But if your symptoms that are getting worse aren't pain, but are brainstem mediated symptoms around swallowing or breathing, and you're kind of on the cusp of not being able to swallow or breathe, but you kind of can still, and somebody says, that's going to get 10% worse. Wow, that begins to feel unsafe. Because when you're asked, well, what's that going to be like if you're 10% worse with that? You think, well, I don't know. Because how am I going to breathe and swallow? So I don't know. Unsafe. Safe, unsafe. Disability versus suffering. Stability versus volatility. Notes help with brain fog. And then safety versus unsafety. So let's get to my experience now. So I'm going through life with all of these background ME symptoms that I've shown you that are limiting my work capacity to working 2 or 3 hours from home. I can sometimes move around the country, sometimes move around the world, but not often. I haven't left the country in a few years now. I'm in the UK. And so, I'm going along. I'm actually on a trip in Devon. And I am exposed to COVID. And a couple of days later, definitively exposed to COVID. And a couple of days later, I'm lying in bed. And then I get a sharp chest pain, boom, that just presses in a very extreme way in a spot and doesn't go away for quite a while. And so I was thinking, if that went away, that'd be part and parcel of ME weirdness and autonomic weirdness. But the fact that it lasted for a long time, I said, ooh, I wonder if something sort of not quite right is happening or developing. And then on day 5, since exposure, I woke up with suffery and unsafe symptoms. So I had a lying down heart rate of about 170, 180 on beta blockers. Had tremors and shaking and feverishness and a kind of a rush of a poisonous pulsating feeling throughout my body, acute muscle pain and breathing and swallowing problems, and I couldn't speak. I was very calm, partly because I've experienced a lot of extreme stuff with ME. And at that point, the decision that I had to make, and this is where our first tip is going to come in, is, do I go to hospital? So let's talk about ME and hospital and ME and COVID and hospital. So if you've got ME, there are 3 ways really for you to end up in hospital. I'm going to talk about the third one of them, but we'll mention all. The first one is you've become very severe with ME and you need to be in hospital for your severe ME. And that's an extraordinarily difficult situation because basically hospitals don't know what to do with you in that case. And in fact, I was actually in Devon and Exeter to see Sarah, the mum of Maeve, who died from ME in 2021, having had a terrible hospital experience. Now, the second way to end up in hospital with ME is you're just really feeling atypically weird, you don't understand what's going on, and it's bad, you're really, really unwell, so you go to hospital and say, well, what the hell is going on? Help me figure it out. That's also a really challenging way to go to hospital, because the reality is it's going to feel a little bit like you're going into a 16th century hospital, right? They're not going to know what to do with you. So the way we're going to talk about going to hospital is the third way of going to hospital, the way that I was considering going to hospital. I'm here in hospital and I know what I need. On this particular occasion, after a few hours, my heart rate was brought down by more and more beta blockers, and I made the decision not to go to hospital. I have been hospitalized with extreme neurological symptoms from ME in the past, and I've been to hospital like that many times in different parts of the UK. So I have the experience to talk about this. Now, here are my tips. It's good to have a letter with your medical needs that explains some of what's wrong with you without necessarily mentioning ME. Now, I have such a letter written by a retired GP who wrote it with the help of my specialist for many years, Nancy Climas. Tip 2, have clear asks and explanations in that letter. So my asks, most of them are in the letter, I think, but my asks are very clear if I end up in hospital. I need saline, I need oxygen, and I need my heart checked because I also have a non-ME related heart issue, which is a dilatation of the aortic root. So if I have a lot of chest pain, then there's a good reason to check that. So, and then the other symptoms, my letter dresses up in terms of dysautonomia-mediated chest pain and other symptoms up to hypoxia. So my letter doesn't even mention ME. So it's coming in with some very clear asks and explanation for the asks. Third tip, they're all related, these tips. Leverage any non-ME conditions you have and frame ME symptoms in terms of other conditions to make it clear to the hospital what your needs are. Again, I have been referred to by some specialists as having atypical MS, multiple sclerosis. That's actually going to be more comprehensible in the hospital environment than if you say ME. Now, if we had proper education and proper medical training for medical professionals, that wouldn't be the case. Don't give them details that they're never going to understand. So, for instance, my breathing and swallowing problems are brainstem mediated. Often that happens due to inflammation. Sometimes it happens due to structural problems. And talking about that in an emergency situation in the hospital is like explaining Aristotle to a 12-year-old. It's just not quite right. In fact, Aristotle for 12-year-olds is easier to convey. Make sure you don't get psychiatrized or psychologized and that none of your symptoms are interpreted as a panic attack. I have been to hospital several times with breathing and swallowing issues. It has never even been suspected by anybody around me that I might be anxious or I might be having a panic attack. But that is in part because I am male and white, because I speak confidently, and because even when I was taken to hospital quite in a bad way by an ambulance once, and I couldn't talk, I was very calm. In other words, I winked, I went like that, I flicked my fingers, and I communicated in a calm and authoritative way. So I've never had that experience, but I appreciate, especially if you're very anxious about these terrible things that are sort of rapidly happening in your body, how much it could be a risk that you get treated like you might be having a panic attack. And you could conceivably have a panic attack if you have ME and you have terribly weird symptoms, but the chances are that's going to be a panic attack that's not the cause of the symptoms, but something that results from them. And the chances are, just from my experience, most people having these extreme symptoms aren't going to have a panic attack. My journey, several weeks on, it's been maybe 3 weeks already, and here I'm going to be very, very brief. But it's interesting because there is a kind of common picture that emerges for a lot of people with ME who get COVID, especially if their experience is overwhelmingly non-conventionally viral symptoms. Let's say because they got exposed to a small viral dose. Very central feature of my experience was extreme volatility, and still in fact is the case, even though I'm a bit better, quite a bit better, but still not in a great place. And you might say, what are you doing talking about not being a great place when you're sitting here talking to us? This is probably me half an hour later. So volatility was a big thing. And my ME is normally volatile, right? I can be in a really bad way for 3 hours a day and then functional for 2 hours a day. And then somewhere in the middle, the rest of the hours. But this is volatility like I've never encountered before in 21 years. Things were changing quite rapidly every 10 minutes. It's like, very volatile. It's very typical for ME people who've got a response to COVID to have a head situation, a chest situation, a gut situation, and more neurological weirdness. So these four are among the typical sort of modes of either deterioration of current ME symptoms or manifestation of new symptoms. My head experience is most analogous, on top of the regular ME head symptoms, to being on top of that very concussed. I got hit by a van in 2017 and I had a concussion, nothing serious. I had a concussion for about 6 months. This is 8 times worse, right? You have problems bending your head down. It feels like there's bowling ball inside your brain. Any movement, even in bed, feels really extreme head-wise. Guts, conventional stuff, I won't talk about it. Body stuff is sort of all the typical symptoms, but worse with more bizarre pulsations and sensations. Neuro stuff is the breathing and swallowing stuff getting worse. Pain is more acute. And then chest is what I want to talk about the most, because that's interesting and that's a common problem zone for ME COVID folks. Now, I think there are 4 ways you're going to have chest issues with ME. Autonomics, autonomic imbalance, low blood volume. You could have a chest pain in some conventionally cardio way, of course, that's possible, like coronary artery spasm. You could have a respiratory chest problem, right? A viral sort of chestiness from conceivably COVID. And you could have neuro chest problems, right? Sort of, let's say, breathing issues that are chest problems without really being chest problems. It's just your brain not doing well at controlling your breathing. So that's been all of the above for me, plus really a sharp pinpoint chest pain upon any movement, including even now from being sitting up and talking to you. Now let's move to emotional tips. So the first emotional tip is that, and this is good for people who are outsiders to understand, but it's also good for ME folks to understand. You're going to feel doubly stranded, right? Having ME is a bit like being out at sea without oars. And that's not just because the condition is difficult and volatile, it's also because you have to kind of carry yourself. You have to some extent, be your own doctor, because even if you are in amazing medical hands, there is still such an insufficiency of research that you have to think things through afresh when new things happen in your body. So it's always this zone of uncertainty. That's normal ME, right? Out at sea without oars, with half a sail. This experience, having a reaction to COVID plus ME, redoubles that. Yeah? You're doubly out at sea, because certainly my experience over the last few weeks has been that this is as removed in terms of greater weirdness from my ME as ME is from normality. So you traveled, in my case, 21 years ago from normality to ME, and now you're traveling from ME to ME plus some additional and considerable weirdness. The second emotional tip is really around the feeling that you, while you're having this experience, may not feel seen enough. That's not my experience. I felt seen, but there's a risk that you might not feel seen. You're going to have comments like, "Oh, I'm sorry, you've been badly hit by COVID." And that's not really what's happened to you. What's happened to you is that you are more susceptible to react and to COVID badly, to be more damaged by COVID. And that's your experience. And you're also going to get comments like, oh, I'm glad you're better, you know. But actually, this is a very volatile process, right? I mean, my chatting to you now is 5% of my day. It's not representative of 95% of my day today, right? And it's also possible that today I can talk with you sitting up, but tomorrow I talk with you lying down because that's all I can do. And you might assume from that that tomorrow is a worse day than today. That could be wrong. It could be that today is a much worse day, but I found the moment to be able to sit up and do this. Whereas tomorrow is actually better because the worst bits of it are not so bad, but the best bit of it isn't quite good enough to sit up. But overall, it's the case that tomorrow is better than today. So don't judge people, right, by the top 5-10% of their experience on the day and assume that that generalizes, right? And so ME patients will feel not seen because of this. Oh, you're better because you weren't sitting up a week ago and now you are. Maybe, maybe not. Now let's move to some concrete emotional worries. So when you're first getting COVID with ME, you're going to have, I think, 4 major worries. First worry is that you're just going to be worried about getting very sick. Second worry is that you're worried that your ME will be reset or set back for a long time, if not forever. The third worry you might have is of having, if you like, long COVID with ME. Now, what does that mean? Now, a large percentage of people with long COVID would meet the ME diagnostic criteria. On blood tests, that would also look very similar to ME patients. However, because the trigger is different, COVID-triggered ME may be slightly different, in some ways more than slightly different, to ME triggered by other things. So you're worried that you're going to develop a sort of an extra dimension to your ME that you didn't have before. And we could call that having long COVID plus ME, or you could just call it, ME that predates COVID with an extra twang of post-COVID ME thrown in. The fourth thing you're going to be worried about is that you're going to be, especially if you have a range of activity, you may be getting too sick to do the regular ME management that keeps your ME from getting worse. That's to say, you may not be able to rest in bed effectively because you have just too many symptoms. You may not be able to do any sitting up or upright exercises you do to help with your ME, for instance, breathing exercises, right? So you could be in a position where you're getting worse because you can't do the things that help you stay level. My biggest emotional tip is really having faith. And the way I describe this is that faith is the virtue of bridging today with tomorrow when there is deep uncertainty. I'm not talking about religious faith. I'm talking about faith as in walking with uncertainty. That's tip number 1. Relatedly, tip number 2, don't sort of set your hair on fire 12 times about things going wrong. Do it just 2 or 3 times, right? This is going to be potentially a medium-term journey for you coming out of this. You may not come out of this fully. So, do not freak out 17 times about this when you can only freak out 2 or 3. That's not going to help. My third tip is that you need gentleness from people around you, and you need to specifically request that. So the most important people in your life, tell them to talk to you only about big and beautiful things, like their love for you or the walk in the park they've done. So that just means, I need gentle thoughts from you, dear friend, family, carer. I think this will do. Lots of love and thank you for being with me.